Hi, Dr. Paul here. I've got apparently some very fascinating feet to look at. So we're going to take a look. So this is this young man is 18 years old, and can you share the story with me about when this happened?
A few days ago, I started to get red bands in between the webs of my toes, and within about 4 hours they erupted into blisters. And then a day or so later, my feet all the way up to the ankles started swelling.
Impressive. So you can see we've got blisters that haven't popped here, and it looks like blisters probably popped there. Definitely we've got raw skin here with a blister on the side and these blisters between the toes. I can see that you've got swelling probably up to about that level, and that's impressive. Now this had happened before, about 2 months ago, I understand.
Yeah.
And at that time it also came up pretty fast in the matter of a day or two, and that particular episode was treated with an antifungal and doxycycline. And I actually, it's difficult. Does this hurt when I move your toes?
That's all right.
Okay. There's a big blister just sitting between the toes. Have you been struggling with athlete's foot lately?
No.
Not really?
Never had it before.
Okay. When you see these big blebs with fluid in them, the term that comes to mind is bullous, like bleb, impetigo, or along those lines. If you had gotten into some poison oak or poison ivy, like you were walking barefoot through the forest, you can get this kind of a local reaction to a topical exposure to something like that. But I think in your case, this is an infection that just exploded like this. So we're definitely going to want to treat this and then make sure we're getting you better, because if not, we need to rethink it, right? Mm-hmm. All right. And you haven't had any fever.
Correct.
There is some warmth. The part that turns red does start to feel warm. And, my YouTubers are going to go nuts that I'm not wearing gloves. It's incredible. They just freak out that I'm not wearing gloves. I'm going to walk right over here to a sink. YouTube land, soap and water is amazing. Wash my hands just the old school way. I don't want people to freak out about infections when good old soap and water will work, Anyway, old school. Well, thanks for sharing this. We are going to definitely cover you with an antibiotic that covers staph and perhaps strep. Those are the two most common organisms that will give you a bad skin infection. I think when it's bullous like this, I tend to think of staph. And the fungal component of this is certainly a possibility, but it came on so fast, I'm a little suspicious that this is just a quick bacterial infection. So we'll talk more about our options, but I'm going to take a culture of this so we have a backup. If it's not getting better, we'll know what exactly we're treating. And when the labs do these cultures, so we've got fluid here. That's just sort of been oozing out. I know you unwrapped it, and you can see that's just soaked with fluid. So there's no doubt that if there's bacteria here, it's going to grow.
What's the name of that fluid?
This is called serous fluid because
protein.
Yeah, and again, folks, no gloves. Shocking, but this is a Q-tip. It's the Q-tip that touched the wound, and watch. I very carefully got it through there. Okay, I get so many comments about it. I thought, oh man, I'm gonna hear it for sure. So you'll notice the end of the toe is pink, and if we push on it, it blanches white, and then 1, 1,000, 2, 1,000, 3, 1,000, it's pink again. Let's do that again. So blanch it, 1, 1,000, 2, 1,000, 3, 1,000. That's normal circulation. Because of the swelling you've got going on your foot, It's a little pale there, and I think you're losing a little bit of circulation. It is theoretically possible for something called a tourniquet syndrome, where you get so much swelling and pressure that it cuts off blood flow. And that would, of course, be something we don't want. And so you're going to watch for that, and you're going to watch that capillary refill on the ends of his toes. If they get so swollen that you're losing blood flow that's putting your toes at risk, they're going to be cold, turning blue, and they won't have any and you're going to come see us right away. And I'm going to send you to a surgeon. It won't happen, don't worry. But that's what you watch for. All right? We've got our culture. We're going to send that off. We're going to start this young man on antibiotic, and we'll give you an update on how he did. So let's give this guy lots of likes for being willing to share this with us on YouTube land. Thanks for watching, and I'm Dr. Paul.